Can you briefly introduce yourself, sir?
Right, thank you. My name is Wellington Oyibo. I'm a professor and consultant medical parasitologist
Okay.
and current director of the Center for Transdisciplinary Research in Malaria and Neglected Tropical Diseases of the University of Lagos, Nigeria.
On Thursday, Gavi gave our country some doses of vaccines. So, what do you make of this donation? Let's start from there. What do you think, as an expert who has been in the forefront of the battle or the fight against malaria? What do you think about this gesture?
Donation of vaccine is a welcome idea, but it's coming late for malaria vaccine. And it's been a journey because Nigeria, even for the clinical trials and implementation, was not included. And then if you look at the dynamics of malaria globally, where we remain the country with the highest burden, in which WHO says itself that much impact is required. And if much impact is required, why the vaccine is not coming as a blockbuster intervention, because it has to be used with other interventions. It's still not coming too early. But again, half bread is better than none. Of course, we have to understand what the vaccine indications actually is. Of course, for many of us, we wanted Nigeria to take leadership in issues like this. And the leadership will be that the country is forcefully making an argument, preparing our grounds, and not now waiting for this long to have, you know, interventions like this. But
As Africa's most populous country, Nigeria carries the highest burden of malaria globally, accounting for approximately 27% of the global malaria burden and 31% of malaria deaths worldwide. Are you not worried that a clinical trial of the vaccine was not carried out in Nigeria, or Nigeria was not even involved in the trial, and now they are bringing the vaccines to us?
one,
Is it
as a
not?
Nigerian, and two, as a researcher, we raised this issue several years ago when the
Yeah.
clinical trials was being done. And what I believe is that Nigeria is not a small country in the Committee of Nations. And we really should not be at the back seat when it comes to what is required, because in the private sector domain, whatever is good, whatever is useful, we have. And I know with some couple of people, we are trying to see how we make a case for a very strong, make a business case for interventions such as the vaccine. So the country was unsettled when the clinical trial was not done in Nigeria for some reasons. It was done in Ghana, done in Kenya, and Malawi. And we have seen two interventions, like even the clinical trial for sulfadoxine pyrimethamine, which is used for intermittent preventive treatment of malaria in pregnancy. It was actually done in Malawi. And we have all of these, and you come extrapolate in Nigeria. But apart from the fact that Nigeria is populous, the malaria situation in Nigeria is not the same. So you have many drivers, there are likely going to be some variations among the ecological zones. And we'll have 5 of those typical zones in Nigeria. And then in each of these, you may have different parasite types, and you want to see how this vaccine is working. So, yes, as a country, there are things we should have done, and we believe in negotiation, diplomatic negotiation. If not, again, the worry would be that why are we at the back in this? And that's not known to Nigeria. Of course, there were certain criteria that we have followed in selecting those three country sites. But it shows again what our investment should be, what our investment in research, in cutting edge research, and and portfolios like that, how it should be. And but I know things are changing with the vision of the current Minister of Health and Social Services. So those ones have happened, and Nigeria is ready. We can talk about that, really. But even the fact that it was not done, it has not completely excluded the fact that we can still do formative research in places where these current donations will be deployed. So that's an opportunity we must not miss at all, and then to see how the vaccine works with the parasite population in Nigeria.
Nigeria, based on current statistics, we've got over 200 million people, and Gavi they are giving Nigerian 846,000 doses of malaria vaccines. Do you think this will make any
My
impact? Do you think this
response
will?
to that first will be, let's look at the indication of the vaccine. The indication of the vaccine is very important. Number one, the vaccine does not go alone. Okay, and it has to be used alongside with vector control and uh, effective case management, diagnosis and treatment, and used with other interventions, preventive interventions such as seasonal malaria chemoprevention or perennial malaria chemoprevention in those places, and other interventions such as environmental management. So it's not on its own per se. And one of the arguments really from Africa here is, how much can we do without a vaccine? Because it's shown here, if you look at the RTSS1 vaccine, but there are two vaccines now, of course. So two vaccines, RTSS and R matrix 21, R21 matrix. And the goal is to really prevent death from severe malaria because of, in those children less than 5 years, those where they use the vaccine and other measures, there was reduction in mortality. So those are key things. Of course, the coverage for our matrix 21 was quite high, over 70%. But basically, the question we should ask ourselves is, if we use other measures very well, we are likely going to do well. If we use vector control, avoid, reduce man-fly contact, and we say, let us do it, I'm telling you, we will have a very, very good outcome. You see, like the nets are not being used. There are other things around, the re-engineering of the environment, which we have not done. These are things we must begin to look at. I would rather want to focus on how these other interventions are being used and the value placed on it, and the expanded coverage. One of the things we see here, which we must tell ourselves, because if you push some stuff to vaccines, they are primary measures which we all must agree and subscribe to. Okay, and when we agree and subscribe to it, we will reduce the malaria burden. We will reduce the contacts between the mosquitoes and man. And then there are other measures too to be put in place so that even the parasites we can. So these are all within our country. They are all within us as a country. So, like I said, the vaccine is not coming as a blockbuster. But if we said we want to change our narratives, and first of all, is to say that malaria, though a clinical disease that can cause death, is social. Malaria is social. And if it's social, that means it involves everybody. And I keep on saying that even just putting an innovative screen on your windows and doors, and we all agree to do it, we will cut off the whatever, we'll reduce the burden. So that's my kind of opinion. So the vaccine does not go on its own. For the efficacy that has been described, it is used alongside with every other measure. And then the question to ask now is, are we going to religiously and faithfully use other measures alongside with the vaccines? There are certain areas of the country where you have very high mortality. I'm sure those are the areas we want to target. as they want to use those, as they want to deploy the vaccines. So we too must be ready to put the science into this deployment, and then we can get data for Nigeria.
I recall during the COVID era, the noise about getting COVID-19 vaccine, get this first shot, get this second shot, and it was everywhere. Today, nobody cares about COVID-19 vaccine. Well, to the best of my knowledge, people we've moved on as if nothing has happened. Now, it is malaria vaccine now. There's a lot of fanfare, a lot of noise about malaria vaccine coming to Nigeria. Like, so many people, they think, oh, there's an end to malaria, they've gotten a vaccine. Are you
And
not
you know
worried
what?
that the next 2, 3 years, nobody will be talking about vaccine? People with the nonchalant attitude will continue, and then again, the
My
burden
my
continues.
take on this, which I've already explained.
Yeah.
You know, the descriptions around COVID vaccine is different. But so malaria vaccine, as far as we're concerned with the indication, is that it is not a standalone intervention.
Yeah.
It's not a standalone. We must increase our vector control. All measures to stop the mosquitoes must be increased. And then secondly, every other preventive measures, like those that will involve taking of medicines alongside. And then when people have malaria, they are properly diagnosed, confirmed, and treated. All of this to be put into better use. And don't forget, there's this reconfiguration now that the Honorable Minister of Health is not just the Minister of Health, it's now the Honorable Minister of Health and Social Services. And that brings in a bigger deal of an expanded way of looking at diseases and how the interventions are deployed. So the social dynamics are very, very important. And then I'm sure, and that's what is going on. And that we must combine both to see that we have a far more holistic, just like health seeking behavior. How come people don't go to the hospital when when they feel they have malaria? And just to let us know too that the Honorable Minister of Health tried to query query the burden of malaria, and we are looking at that too as in Nigeria. And the data is what we are still trying to knock around to see that has malaria changed in the country? Is Nigeria actually the highest burden of does it have the highest burden of malaria? So there was a conference which he did with stakeholders to rethink malaria. And part of it is, and what we see in our different locations, is that the way malaria was before is not how it is today. But I know there are matrices by which WHO reports the malaria burden, which we are looking at as a country as well. But one of the things I can tell you clearly in a number of places, the malaria epidemiology is changing. There's reduction. We are now looking at the root causes to say how are these cases being reported. And we are seeing now that in the health facilities, there are some challenges around, correct documentation. Okay, and that's those root causes are being really seriously unbundled. Because if you presented in the health facility and on the basis of symptoms, and that is what is documented, not all fevers are malaria.
Mm.
And where we have watched carefully, you see that those documentation is what goes into the national database for reporting.